already been. Now it's started recording. I think
Yeah,
you can
I'm
start.
starting it and I'm trying to share.
Okay, ma'am.
Are you able to see my screen?
Yes, ma'am. We can see and it's moving.
What? Can you see the slides?
Yes, we can see the slide. Ma'am, will you please move the slides? Yeah, ma'am, it's moving also.
Okay, fine. Now, today's topic for us is occupational patient and worker safety. Right, this is, I think, an elective topic which you have chosen. Now, let's understand what sort of occupational hazards a worker in a hospital or a common treatment facility face. Can somebody point out to me what sort of hazards? What is a hazard? Yes, what sort of hazards does a person in a hospital face? Anybody for that matter, anybody working in a hospital, what sort of hazards they face? Or what sort of problems they have for their health if you're working in a hospital? Yes, please. Yeah, I need somebody to respond.
Ma'am, sorry, my mic was off.
What?
My mic was off. Sorry, I was telling, but my mic was off.
Oh, okay, okay, fine.
Ma'am, any type of danger which happens during the workplace.
Okay, so any sort of a danger. So what sort of dangers do people working in a hospital basically face?
Ma'am, it can be a needle stick injury or it can be a chemical leak, chemical spill or something.
Mm-hmm.
And
So as it's written in the slide, it can be chemical hazards or it can be physical hazards also, because sometimes you're exposed to certain extreme temperatures and radiation. Biological hazards, everybody understands, it could be bacteria and viruses, you are exposed to it. Any infectious patients is there, you can always you are exposed to such infections. There's psychological stress, and one more thing which we usually go unnoticed is the ergonomic strain. What I mean by ergonomic strain is that when you design your workstations means the place where you work. So sometimes it will be so odd that you will have excess strain on your back or on your neck. For example, if anybody is working on the microscope, have you noticed people working on the microscope? They have to bend and see. Whenever they bend and see, there is a strain on the neck, right? So if it is not designed properly, where it is, at the eye level and they can see it properly, then they are bound to have such kind of musculoskeletal things. And radiation, of course, you see ionizing and non-ionizing radiation based on the place where they work, especially with CT scans and X-ray machines. You always have ionizing radiations which people are exposed in the hospital. Agreed?
yes, ma'am.
All right. So what if they are exposed? What is the impact of it, and how can I prevent it? If they are exposed to sharps, you will have exposure to blood and blood-borne pathogens. This can result in exposure to blood-borne pathogens. What will happen if you are exposed?
May lead to a chance of infection like hepatitis B, C, and all.
Yeah, hepatitis B, C, HIV, or malaria, depending on it. How can I prevent these?
Ma'am, proper
Proper
handling,
handling
handling
and
of the
immunization.
samples and
Hepatitis B.
shots.
Huh?
And the worker and healthcare worker should be pre-immunized for hepatitis B and all.
Yeah, immunization can be done for hepatitis B. For HIV prevention, you can always use universal precautions where you protect yourself by using gloves and apron and other things. And certain times, or even if you sometimes, despite taking all the efforts, there might be some exposure for which you always have a post exposure prophylaxis which is there. Now, what about the other biological hazards? There also you can use the same methods, and depending on the biological hazard, suppose it's an airborne or droplet borne respiratory droplet infection, then you can have disinfection of the surfaces, disinfection procedures, and housekeeping procedures which can be used to avoid infections from spreading, and use of masks, right? If it is chemicals, how do we go about with these chemicals, and what sort of chemicals are there with us in the hospitals? The most common ones, what are the most common? uh,
Chlorine solution.
Chlorine solution, yes. Most common disinfectant is the hypochlorite solution, which we use for disinfective agents. So, when there is an exposure, has anybody had an accidental exposure to chlorine? What do you do?
No, ma'am.
Do you have mechanisms as to what needs to be done? Is there somebody who's trained in these kind of things in your hospital? So, you need to find out every material, disinfectant or any chemical that comes, it comes with instructions as if there is an accidental exposure, what needs to be done and how it needs to be disposed of. They call it as a material safety um, pamphlet or something. It's always given with every chemicals that are being dispensed. So you need to know how it needs to be disposed of, and if there is an accidental exposure of that particular chemical, what precautions needs to be taken also should be specified. Okay, now what can we do with something which is very hazardous chemical? At the most, we can help substitute it with something else which is less hazardous but equally effective. Now, another thing what we have is physical hazards like lifting. The most common lifting thing what we have in our hospitals is to shift the patients, right? Agreed? Not all patients will be very thin and easily liftable. There might be some FT patients also that come. So lifting is something which is generally done. So you need to teach the workers lift in such a way that they don't strain their back, or use of automated transfer ones which can help in prevent such problems. Ionizing radiations, you all know, the best thing is to protect yourself by using those devices to see how much of ionizing radiation is exposed. Now, when it comes to ergonomics, where ergonomics is design of work tasks to suit the capabilities of a worker, right? That means you're changing the workplace to suit the worker. You're not changing the worker to suit the workplace. All right. Say, for example, somebody is very short and their workstation is little bit higher, so you need to change the chair or the level of the the desk so that it is helpful for them to, and they don't cause any strain with the back or their neck because of this abnormal positioning. So all these things, these will lead to musculoskeletal disorders. So let's look at the biological hazards what we have. You have SARS. Know what SARS is? How do we manage? How did we manage with COVID? Anybody can share their experience. What did we do to prevent the healthcare workers from or having getting infected with COVID?
PP use की N95 mask,
Uh,
proper distance.
yeah, distance, physical distance, N95 mask, and PEP. This donning and doffing of PEP was very strictly followed, right? As soon as there is donning and doffing, you would take a bath and then come out. So there's in some places there were also UV radiations that were sent onto the skin and other stuff. Many things we did, isn't it? But the same case with other kind of things like SARS or severe acute respiratory syndrome, influenza or Ebola, how best we can manage so that it doesn't spread to our own healthcare staff. So one is negative pressure rooms with doors closed. You can have single rooms with their own bathrooms, or you can have, or what we can do is all the people who are infectious can be there in one particular place, turning off of air conditioning, use of disposable equipment, and patient movement to be avoided. These are some of the things what we can do whenever there is a biological hazards of SARS or any infectious disease for that matter. It depends on how infectious. Suppose there is a, for example, there is an outbreak of some gastroenteritis. Now, for that, how is it spread? The gastroenteritis, it is a fecal-oral spread, right? Or it can also spread through fomites. So the best way to prevent that is to have good housekeeping measures where they are cleaned, and then disinfective agent is there, is used on all the surfaces so that you don't really get through the fomites, you are not infected. Agreed. We used to do this initially in COVID. In the first wave, every place used to, once in 3 hours, they used to clean the surfaces, the door knobs, the doors, and all these things. So, this is one way of avoiding biological hazards. And of course, use of masks and face shields and hand hygiene is very, very important, whether you have any outbreak or whether you do not have any outbreak. In general, the dictum is when you are moving from one patient to another patient, once you finish examining one patient, you need to wash your hands or use an alcohol rub or whatever it is before you go to the next patient to examine. Otherwise, you might be spreading organisms from this patient to another patient. Mostly, you will find staphylococcus and streptococcus things which spread like this. So, the next thing when we look at apart from the biological agents is the sharp. Okay. Now, can anybody tell me, has anybody had a needle stick injury? And how do you prevent this needle stick injury from happening?
By avoiding recapping of needles.
One, recapping of needles. Fine. Then, just by avoiding recapping of needles, do you think you can avoid needle stick injuries? How about disposal of it? Suppose you throw it anywhere and everywhere, somebody can get pricked with it. So, what next do you do apart from
After use, put the needle in a white puncture-proof container so that no one can harm.
Exactly. So you're basically trying to dispose it off in a safe place and see that it doesn't come across anywhere where it can injure others. One, you're trying to destroy the needles also. In some hospitals, you have needle destructors that they use electricity and burn them off. Or in some places where you have a very sharp blade which will also cut the syringe as well as the needle, separate the syringe and the needle. And one of the foremost thing whenever whatever you do is whenever you're handling sharps, always do not pass the sharps through hand. Better to place it in a place so that people can take it and there is not much of a injury that can happen. And another issues with needle stick injuries what we have seen is people who are anxious and who are very new to certain places can also endure this needle stick injuries. So before we allow them to do it on patients, it is better they practice on mannequins or any other place which is safe where they don't have any such injuries. Then they can come over to the patient side so that they are used to handling certain needles and sharps. Okay, last thing what we said, the inclination to recap the needles. How, where do you think we recap needles? At what juncture do you think we'll have to recap the needles?
while taking after taking sampling and after
Huh?
taking
Huh?
sampling
No, but usually you discard it
yes,
immediately.
ma'am.
No. Now, where do you think this recapping will come? Suppose in a ward, the patient is somewhere and the waste station is somewhere. So the person has to walk all the way from the patient till the waste nursing station or wherever the bins are kept. In this process, to avoid that, you generally recap the needles. So the best way to avoid this is in your dressing trolley itself. If you have a container, a puncture proof container for needles, then as soon as you finish your work, it is immediately put into the puncture proof container, avoiding this need for either recapping or trying to asking getting somebody to segregate the waste after you have finished your dressing, or any other procedures in the ward or any other place. So the dictum here is to avoid any sharp injury is best to segregate it at the point of generation wherever it is. Now, another waste that we generally encounter is the chemical waste. What all chemical waste we have? We have disinfective agents which are there, and mostly you get across as disinfective agents. Now, the best way to prevent them is to use a personal protective equipment, gloves, and an eye protection. Another problem what we have is the radiation. For radiation, ionizing or non-ionizing radiation, or if you are using any cytotoxic drugs, apart from providing the personal protective equipment, there should be a mechanism how these things are collected and disposed of. Because for ionizing radiations, it comes under the radioactive substances disposal comes under a different rule, and it doesn't come under the biomedical waste management rules. But maximum protection should be protective measures should be given for all workers. So when you look at cytotoxic drugs, where do we use cytotoxic drugs? No, what? Huh?
For
Where do we?
chemotherapy,
In for chemotherapy and
Yes.
for chemotherapy we are using cytotoxic drugs.
Chemotherapy. So this is done in only a few hospitals, not in every hospital. Cancer treatment doesn't happen in all the hospitals, right? In very few places you will have cancer treatment. Wherever there is cancer treatment, cytotoxic waste are generated and radiation waste is also generated. So what does the rule say for cytotoxic drugs? How it needs to be disposed?
Be
It has to
disposed
be
in yellow bin and it should be labeled as cytotoxic drug.
exactly. There's a symbol for cytotoxic drug which says C, right? So it has to be going there. All the things which are come in contact with cytotoxic drugs should go inside that particular bin. And what happens to that particular bin? It is taken to the common treatment facility and then incinerated. There should be separate collection and transport, and the person who is discarding should be adequately protected from exposure. So that is with regard to the hospital so far. Now let's look at the common treatment facility. In the common treatment facility, what are the hazards that any person will face? Has anybody visited a common treatment facility?
No, ma'am.
What do the waste? What will happen to the waste once it is outside your campus? Has anybody visited a common treatment facility?
No, ma'am.
Do you have any idea? Have you seen? Yes. Yes. Come on.
Ma'am,
Has anybody
no, I
seen?
haven't visited any common facility center like that. But after collecting, then they will properly treated that.
Hmm.
Then do the
Okay.
disposal as per the
Rules.
waste
Okay. Now, what do we have here? We do have, you all know that whatever goes into the yellow bin goes in for incineration.
incineration.
Okay. And whatever is there in the red will go in for autoclave.
Totally.
Let's us understand what is incineration. It is basically burning. So there will be heat that is generated from an incinerator. So another thing what the person common treatment facility person does is he is not going to sit and segregate. In some places they go sit and segregate whatever that can be recycled from the waste that you are giving, because they feel that whatever waste any hospital gives is not adequately segregated, and they tend to do that there in the common treatment facility. I have seen these things certain times, but off late people have stopped doing it because that is the most hazardous thing. You are exposing your people who are working in the common treatment facility to hazardous biological agents, right? We are not sure whether not all hospitals are very strict in following the rules. They should actually pre-treat some of the things and send it to them. If they are not pre-treating, the person who is handling at the common treatment facility is exposed to these kind of hazards, right? So when they are loading the incinerator, there might be chances that they are exposed to heat, and the worst kind of things that they get exposed is the um, is your persistent organic pollutants. What are persistent organic pollutants means? When there is an ineffective use of the incinerator. That means if they do not burn the waste properly through incinerator, there are a set of pollutants that are released from the incinerator because of inadequate burning. And these pollutants are something like, they are persistent in nature. That means they stay in the nature. It's not that they are going to disappear or disintegrate. And they are organic in nature. They have a lot of other problems. They cause endocrine disorders, they cause sterility, they cause cancers in most of the people working there. So therefore, this is the worst kind of exposure that they can have whenever it comes to working in a common treatment facility. That is exposure to persistent organic pollutants. And other chemicals can also be exposed because there is a sludge or wastewater sludge that comes in there. So there are lots of other chemicals they get exposed to because all the waste that is here is dumped there and they take it. But how is it that we can prevent it from happening is to see that they are educated enough and they are aware of the hazards that they are facing. One. Two, they have to be taught how to use the personal protective equipment. Many a times in our country, what will happen is these personal protective equipment, even though the common treatment facility people supply to the workers, because of the heat in our country, they sometimes may not wear these the personal protective equipment. So they should understand if they don't wear, who is at fault and what will happen to them. So and the common treatment facility person also should make it a point to provide all this personal protective equipment to the workers in their facility. All right. So these are the two things what a common operator should do to protect it. It's an occupational safety. They are working there, so they need to be protected against these things. And of course, this is our favorite, where you have psychological hazards, the stress and strain of working in certain areas. The best way is to find out your coping mechanisms and then see how best you can manage your stress. Now, there are accidents that can happen. We also talked about sharp injuries. And another thing, what we generally avoid is the spillage. Spills that can happen in a hospital. right? What do you do when there is a spill? What sort of spills can happen in a hospital, or what material can be spilled in the
It
floor,
can be any
or it can
chemical,
be on the
it can
workstation?
be any type of body fluids.
Ah, so it can be any sample. Say, for example, it can be blood samples, it can be urine samples, or CSF, any of the body fluids. One. Another thing, some patient vomits on the floor. That is another exposure we have for biological agents. And another, I'm not sure how many of the hospitals have stopped using mercury based sphygmomanometer or thermometer.
Ma'am, most of the hospitals not using.
Most of the places it has been phased out. If it has not been phased out, breakage of these instruments, you will have spilling of mercury that is there. Or if there is a lab, you may have any of the stains or any other chemicals that are used. Say acids are used for staining, right? Those can be spilled. So these are some of the things which we need to be aware of. If it is a biological agent, the management is different. If it is a chemical agent, the management is different. So whatever the spills, that generally what happens is, even for our rules, we always take note of needle stick injuries, but we do not take we do not take the spills into consideration. How many spills have occurred and how do you manage? Do you all use any spill kit for management of spills?
Yes, ma'am.
Yes, ma'am.
There is a spill kit where you can, whatever things are necessary are kept in that box. Whenever there is a spill, it is used, and once it is utilized, you need to refill it back so that it can be useful for the next spill, whatever happens. So the best way is to transport this body fluids, any material that is having body fluids safely, so that the spillage will not occur. Sometimes accidentally it will happen, we need to handle it. Whenever we are handling it, the people who handle it, especially the workers, need to understand how it needs to be safely handled. They should wear their personal protective equipment, use gloves. They should also know how to discard it. But when it comes to chemical spills, it is better to get a trained person there. It's not the same as managing your body fluid spills that can happen. So, whenever anybody gets exposed to such kind of spills, you need to provide them with psychosocial support and also make a mechanism to understand why the spill has occurred. Just like how you make a note of the injuries, especially sharp injuries, needle stick injuries, it's better to do a root cause analysis for needle stick injuries to find out how best I can prevent those needle stick injuries. Similarly, even for spills, also, you need to have a root cause analysis done so that you can prevent this from happening. Okay, apart from this, there are other environmental issues. It could be because of stagnant water, or it could be because of a contaminated leachate or contaminated water that is there, which can cause there are always this uh, vector breeding sites. If the drainage of water is inadequate, that can happen. Or if the drainage water comes in contact with drinking water, sometimes these have happened, that can cause a problem. So these are some things which can happen. Even these are not, these are just common ones, it can happen anywhere. It is not that, but when it happens in a hospital, it is taken very seriously. Even in houses also, you'll have infestation of rodents, vector breeding sites, all these things can be there. Now, what is it that a person, occupier in the sense, who is running a hospital should do so that they can provide safety for the worker and also ensure such occupational hazards are minimized? The best way is to look for waste segregation, pre-treatment of certain healthcare waste, see that the transportation is done efficiently and safely, and occupational safety to vaccinate and to provide training on hazards. These are the two things which are very important for any hospital personnel to undergo and to be clear whenever there are hazards that are indicated. Now, you looked at bloodborne pathogens, right? There is a mechanism of control for this. How we go about this is a hierarchy of control of bloodborne pathogens. First is your PEP, that is, you're just eliminating or seeing that the bloodborne pathogen doesn't come into your ambit. Then you have controls that reduce the exposure to occupational hazards through behavior of workers. You have administrative control where policies are there. That means anybody, you can write it a policy in your hospital that anybody who's exposed to any such blood spills, they would be provided testing for HIV and they would be counseled. They'll also give a post exposure prophylaxis for HIV or hepatitis B depending on the situation. So these are some of the things which needs to be spelled out within the hospital. If your hospital doesn't have any such policy, please ensure that this safety mechanism is there. Because if this is not there, people will be hesitant to do any procedures. And of course, you can have engineering controls where the exposure is reduced, where needles that retract or needless procedures that are done, a complete removal of the hazard. That is the highest level of hierarchy. I'm not sure if there is complete removal of any hazard that can be possible, especially biological hazards, right? So for your guidelines and policies and strategies, what we need to use is universal precautions, heavy duty gloves, hand washing, masks, and properly labeled things so that you know what is inside the content before you handle it. Protocols need to be established. That means if there is an injury that happens, whom should they go to report it, and what should that particular person do once it is reported? Is there a, do they have to take it up to the higher level, or the decision is taken here by the infection control nurse itself or the ward nurse? So these protocols need to be specifically mentioned. So there should be a procedure for disposing of waste. Similarly, there should also be a procedure for handling any accidental exposures or injuries. So what are the rights of the workers? The workers have a right to be trained. They have a right to work on machines that are safe. They have to be provided safety gears. They have to be protected from toxic chemicals and other hazards. There should be a mechanism where any of their inconveniences are addressed, or grievances redressal system should be there. There should be a mechanism for reporting any such things. So these are the rights of the workers. So for health and safety practices, there should be implementation of standardized management, hepatitis B vaccination, provision of a sharp box, implementation of standard precautions, promotion of hand hygiene, and allocation of additional role to assume responsibility for promoting better worker safety. That means one person is allocated with extra responsibility to see that these worker safety and occupational safety measures are done. Now, there's one more thing that is there in a hospital. We call it as patient safety. What is patient safety? Anybody? Is it keeping the patient safe? Yes. Anybody? What is patient safety? Can somebody tell me what is patient safety?
Ma'am, avoid nosocomial infection in
Yes.
patient.
Yes. Then avoid nosocomial infection. Apart from it,
And any
apart
type
from it,
of harm
huh?
to any type of harm which is
Any type of harm to the patient. For example, you should be careful up to avoid medication errors. like sound alike, look alike medications. So you should have procedures or policies which state that you are not going to dispense drugs without a written prescription, and the prescription will have every detail of it, right? These are some ways where we can promote patient safety and also bring down the adverse reactions that we have. Okay, so we should avoid any unsafe clinical practices. That would include poor hand hygiene or unsafe use of injections, medications, or any medical devices. And one more thing which can be avoided 100% is your communication skills. Sometimes people do not tell properly whenever they're handing over the patients. Like when there is a shift change that happens, if there is any change or anything that is there, proper patient handover is something which will help in avoiding certain, I know, miss medication errors or any negligence or anything of that sort. So it can misdiagnosis is another thing, poor test follow up. So all these things are things that are there that need to be avoided so that we can have patient safety. Basically, we are telling that if a patient comes to a hospital with one disease, you should not add another disease and send them back. Okay, so poor system processes within an organizational culture, sometimes safety culture is not there and they start blaming one another. This will become a bane for patient safety. You will not have any patient safety measures that are there. And also, whenever there is any adverse events that happen, you should learn from them. What was the reason for that particular adverse event? I think one case history is given in your your reading material, where it says that one person comes down with a simple injection of diclofenac when administered to a person without knowing whether they're allergic or not can lead to complications. So anytime when you're, that's why whenever you are working with a patient, the first thing before administering any drug, they ask, are you allergic to any drugs, so that you can avoid it. Okay, there are some drugs which may not cause any adverse events, but you never know. So generally the precaution is you specifically ask the person. Sometimes the person will not know. So when you feel there are chances for the drug to have allergy, for example, penicillin, any products of penicillin, if you are allergic to penicillin, anything you give, you may find it difficult. First exposure, nothing might happen. The second exposure, it becomes a memory and it becomes severe for that person. So therefore, we need to be very careful. We need to ask them if they are having any such allergies and then administer the drugs. Sometimes what they do, when you know that this person certain antibiotics, before giving the full dose they give a test dose to find out if there is any reaction to it, and only then they give it. Another common place where you find reactions is when there is an IV fluid that starts. Some patients complain of shivering, right? Immediately you stop the IV fluid, give them an antihistamine, and then maybe if necessary you restart it, or else you may have to change it. So, what do we understand from patient safety is it's a discipline in healthcare sector that applies safety science methods towards the goal of achieving trustworthy system of healthcare delivery. It is an attribute of healthcare system. Now, how do I prevent? The objective of any patient safety is to prevent and control healthcare associated infections. As somebody said, hospital acquired infections or nosocomial infections. That means it's not like buy one and get one free. You come to the hospital to look at one infection or to get rid of one ailment. You will add another ailment and send them back to them. So that is, if you do not have proper systems in place, this can happen. So we call that as healthcare associated infections. So how do I prevent this is to have systems to support quality and efficient healthcare, and The people who work there should be competent and capable, and also to strengthen capacity for patient safety research. So, what all patient care to have is that the patient should have access to care and continuum of care. The patient should know what are their rights and the rights of the family. How do we manage our medications? That is very important for us. Whether the medications, there is a mechanism for which we see whether they should give this or not. Are they allergic or not? These are some things which we have to be very specific. And one more thing, errors can happen. I've heard many times that the patient, that the nurse would have loaded the injection and kept there and gone for something else, and the doctor would think it is some other injection and given to a wrong patient. Right? Such kind of errors can happen. But what is important for us is how you communicate with the patient when there is such medical errors that happen, and how you handle it is also important for us. You cannot say, okay, I'm sorry, it has happened, and then leave them and go. You need to provide them the adequate care that is necessary because of this particular reaction that has happened or the adverse event that has happened. You may have to, this can also happen in the OTs, right? If the area where the whenever there are two places like say right and left, the limbs, so both the upper limb and lower limb, instead of operating on the left limb, if the surgeon operates on the right limb, it's a problem, right? So therefore, to avoid it, and also the right operation on the right patient, you cannot do another procedure for another thing. So therefore, you will have to check the identity. They'll have a checklist to check the identity of the patient, to check the site where the operation needs to be done, and to check for other things. They'll usually have a checklist to find out all these things, and only then they are wheeled in, whenever they are wheeled into the theater for surgical or any other thing. There's always this continuous quality improvement, in the sense, if such any adverse reactions happen, or if there is any adverse events that happen, what do? Do they just hush it up and say, oh, it has made? No, you have to find out the reason for it. It's not blaming on one person, telling that, oh, you didn't do this, that's why all this happened. Best thing for us to do is to find out what is the reason for that particular mistake in happening. Right? It could be one person's mistake, but still this, it is a system that has failed. Any system you have should not be person dependent, it should be process dependent. There should be a process of checking all these things. So therefore, you need to have a system in place to see that these errors will not happen. So, and even after it has happened, you should know how to take care of it, and see that maximum care or maximum support is provided to the patient after such any events that happen. So another thing what you all suggested was hospital acquired infections or nosocomial infections. How can I prevent this from happening, and where do you find these infections very common?
Ma'am, in
Is
ICU,
anybody yes?
in ICU,
Yeah, ICU, you have ventilator associated infections. Then outside
Prolonged
even,
catheterization.
catheterization, even outside, even in the ward also you will have catheterization. Whenever there is a catheterization that happens, there is urinary tract infection that can happen. Then other things, if the patient is in prolonged is admitted for a longer duration, you have the IV fluids. You can also have your, what do you call them, anybody working in HICC, hospital infection control committee, you can have surgical site infections, you can have
Visual infection, phlebitis.
yes,
Visual infection, phlebitis.
I can't hear you, can you be little loud?
मैम मतलब कैनुला से जो होता है इन्फ्लेमेशन होती है रेडनेस और
Cannula
फिर
40, we call it cannula associated infections that can be there. IV
उसको
fluids.
VIP कुछ बोलते हैं मैम.
Huh?
something like VIP, visual infection phlebitis.
Okay, so there are mechanisms where how you can prevent this from happening. One more thing that is important for us is there should be a mechanism for adverse event reporting and surveillance. Even when such incidents happen, hushing it up and not really finding a solution will not help. Better if we find out the root cause for such defects, such problems, then we there is a mechanism for which you can have uh, preventive mechanisms so that put in place so that this will not happen. You can have a policy. The cannula will not be, I mean, you will not have the same cannula for more than 3 days. Every third day you will remove that particular cannula and then prick the patient in another place. Or for prevention of ventilator associated infections, there could be certain policies or some other things can be maintained so that it doesn't happen. Care of the catheter can be done so that the patient doesn't develop catheter induced urinary tract infections. So these are some things which we need to basically look at whenever we are looking at providing good patient care. Apart from this, there should be an information system. How do I know whether this is happening or not? So for that you will have monitoring and surveillance. I think some set of people or the nurses, they look at all these things, they collect the information, whether there are any such infections that are there in the ward. We need to have a mechanism for reporting these incidents so that they are monitored. And there are also patients, suppose if the hospital is accredited, like say NABH, or if the lab is accredited or NABL, they look at all these parameters. So how have your reporting systems been? How much patient safety? There are certain patient safety indicators that are there. What does the indicator says? And an efficient monitoring system is something which will help us prevent any of these adverse events. Now, you all heard of accreditation. What is this accreditation all about?
मैम मतलब सर्टिफिकेशन होता है जो भी
हाँ, that
उनकी
means to
अथॉरिटी होती है
say
ना, जैसे एनएबीएच है या एनक्वास होता है
NABH है.
गवर्नमेंट
Hmm. What does it imply if you say the hospital has NABH
क्वालिटी
certificate?
मैम, क्वालिटी केयर की, क्वालिटी पेशेंट केयर की, और जो भी मतलब इनका गाइडलाइंस होती है, रूल रेगुलेशंस होते हैं हर
हाँ.
प्रकार के, मतलब लैब के अलग,
that
पेशेंट केयर
that
के अलग।
means that means you are telling that if the hospital has been accredited, you are sure
हाँ जी,
that they follow certain policies and procedures and to
यस मैम,
ensure that the quality of care is good,
यस
isn't
मैम,
it? Would
यस
you
मैम,
would you go to a laboratory which is not accredited? You may hesitate. You may not go
यस
to a
मैम,
laboratory which is not accredited because you are not sure about the processes they use. You are not sure. They may be reporting well, but check mechanisms and other things we are not sure. So therefore, whenever there is an accreditation, means you are ensuring that the quality of that particular institution or that particular report is good. So that is where your hospital accreditation systems are there. You have NABH. Now, of course, in government hospitals, there are quality measurements like Suman is there, Laksha is there,
एनक्वास, एनक्यू है।
Muskan is
Kayakalp and
there.
Enquas.
Huh?
Kayakalp and Enquas, ma'am.
Kaya Kalp is there. Kaya Kalp is for waste management and other things. You have Muskan. So there are lots of things which look at quality indicators. Even in government hospital also. Even government hospitals also can go in for an NABH accreditation.
यस मैम।
Now, the other things when you look at patient safety, global patient safety components are one is the safe injections. What is the safe injection all about? I don't know how many of you have had this experience. The first thing in a rural area many people ask is, give me an injection. मुझे सुई दे दो ताकि मैं immediately I'll get well and start working, or give me IV fluids.
Most commonly.
Most commonly, they ask for it. So these are certain places which are unnecessary. The same thing can be done by using a medication, oral medication. Instead, people want a injection. So safe injections would include keeping the safety of the injection, and at the same time avoiding unnecessary interventions, like avoiding unnecessary injection. If it is not necessary, we may abstain from giving this. Safe injection means that the needle is safe, it is sterilized things are used for it, and the injection is mandated or it is necessary for that person, it is given, and the waste disposal is also done appropriately. Right, these are the things which we follow whenever we are giving an injection. You follow certain aseptic precautions and measures so that you are not introducing any organisms inside the body. So these are things which we look for safe injections. It's a campaign by the World Health Organization also. Now when it comes to blood safety, what does this blood safety come? Blood safety, it all started with HIV. One, to see that the blood which you are transfusing does not have any of the bloodborne pathogens. So prior testing should happen. Testing for hepatitis B, C, then HIV, and then even malarial parasites also. You look for whether they have these things or not. And if any of the blood is found to be infective, they are actually discarded. They are not used. And at the same time, you also look for matching. You have to ensure that the right matched cross matched blood is what is given to the patient. So blood safety is another area where, and to promote this blood safety, they only use for voluntary donors. Earlier they used to have give money for the donors and get it done from them. Nowadays only voluntary donors are used. You do not get it from any outside sources which are going to pay money or anything of that sort. Now, the other place where you have patient safety is the safe surgical care. That means after doing an operation, your surgical site should not get any such infection. That means whenever you're doing dressing, you have to wash your hands before and after it. So, and use your aseptic precautions, wear the gloves, and usually what they give from clean area to dirty area they go, or like that. So those things, that some things which you need to maintain. Then the next thing is your safe childbirth. This is the 5 C's, what we call them as: clean surface, clean cut, that is the scissors or anything that is used to cut the umbilical cord needs to be clean and sterilized. Clean cord tie, the material that is used to tie the cord has to be clean. Clean hands, and one more clean is there. I'm not sure which is that clean, I forgot. So there are 5 C's which we look at to see that any childbirth, whether it is done in the, preferably nowadays all childbirth happen in the institution. You do not find, very rarely you find, at least in down south, the percentage of or proportion of home deliveries are less when compared to institutional deliveries. If there are an institutional deliveries, it is done by a trained personnel who will maintain most of the aseptic conditions for childbirth. And it is the delivery is conducted by a trained person. Now, safe organ transplant, medicine safety. We were looking at medicine safety in terms of there's look-alike drugs and sound-alike drugs. So, whenever you're dispensing drugs, you should be careful to avoid such medication errors. And the devices, whatever we use, also should be of safe. So, we looked at occupational safety, worker safety, and patient safety. So you have lot of things that comes in patient safety, because there's blood safety is there, injection safety procedures are there. All these things come under patient safety. Right? That is something which is important. Your accreditation of your hospital depends on the patient safety things, whatever you follow. Now, do you have any questions to ask me? No questions? Sure, no questions to ask. I know when it comes to occupational safety, it is quite easy. You all, most of you understand. Uh, we are all facing what sort of occupational hazards we have. So, what precautions can be taken is something which is understood. When it comes to worker safety, in both a hospital as well as the common treatment facility, we know they are exposed to certain hazards and what safety mechanisms can be taken. When it comes to patient safety, which depends on a lot of other things, policies in the hospital, the working capacities, the competencies of the nurses and the doctors there, all these things, it depends on patient safety, depends on all these aspects, the policies that are there. Okay, so patient safety is indicative of the quality of that particular hospital. There are some patient safety indicators. I think you can go through your reading material, you will get it. Any clarifications or doubts you have which I can help you out with, or shall I close the session?
Excuse me, ma'am.
Yes, please.
Ma'am, can I get the PPTs?
You want the PPT
Yes, ma'am.
of this? Okay, sure. I can share it.
Previous one also.
I
I am
Huh?
sharing of the previous class also.
Previous class also. My class or Dr. Lalita's class?
Yours only.
Okay, I'll share it with your regional coordinator and maybe he can send it across to you.
Ma'am, I am sharing a link in the chat box. You can just directly upload there.
Upload there.
Yes, ma'am.
No. I'll send it to your to that person, and from there you will get it. I don't think I'll upload it to this. Okay,
Okay, ma'am.
I'll send it to the whoever is handling this session.
Okay, ma'am. Thank you.
Okay, right. Any other clarifications? If there's nothing else, then I'll close the session then. Okay, thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.